Hi, everyone. My name is Dr. Megha Podar, and I'm an endocrinologist and obesity medicine specialist here in Toronto, Ontario. Many people often wonder, what is the point of the BMI and how do we use it to diagnose obesity? What we know is that the BMI, which is a simple measure of height versus weight, has been a very important population screening tool. That's how it was started. It was really an evidence-based way to understand what is the risk factor that this person has with other health issues like cardiovascular disease and metabolic syndrome. We know that the higher your BMI, the higher the risks of these issues to your health. But what we've now seen is that simply measuring the weight on the scale is actually not a good measure of health. You can imagine somebody who lives in a very muscular body, like a football player, actually probably has a very high weight and thereby a high BMI. But we're not actually worried about their cardiovascular health. So when we measure the BMI alone, we're really missing the forest for the trees. We're not getting an accurate picture of health. So really, in the Canadian Clinical Practice Guidelines, we've moved away from just looking at BMI to diagnose obesity. The diagnosis of obesity is now a three-pronged approach. Yes, we still take into consideration the BMI. It's still a helpful overall population-based metric. It's also the metric in which our medications are approved by and the metric in which most research studies are being done. But the BMI alone is not enough. The second important piece of a diagnosis of obesity is measuring waist circumference. Abdominal adiposity is an indirect measure of risk of metabolic health. Things like type 2 diabetes, high blood pressure, dyslipidemia. These metabolic factors are increased when you have a higher waist circumference. Certain cultural ethnicities have a lower BMI but higher waist. We can't forget that patient population and help treat their risk. The last pillar of diagnosis is looking at how much this weight is actually impacting this person's health. The Edmonton Obesity Staging System, which is an excellent tool that you can find on the Obesity Canada website, is looking specifically at how weight is impacting patients' health. It looks at three different categories: the mental health aspects of health, the metabolic aspects of health, and mechanical or functional aspects. You can imagine there's many people who are living in bigger bodies that have no overall negative outcomes to their health. There are many people who are living in smaller bodies that have multiple comorbidities. So we really need to start aligning our treatment to the patient's risk of their weight to their health, not as a simple BMI or a simple treatment target for weight loss. So hopefully that helps you better understand what obesity is, why it's a chronic disease, and how do we move towards diagnosing it without relying solely on the BMI.